If you've ever experienced the discomfort and inconvenience of a urinary tract infection, you know just how disruptive it can be. But for some people, these infections are not a one-time event. Instead, they keep coming back, turning what should be a rare inconvenience into a persistent, recurring problem. Why do some people get chronic UTIs, and what can be done to break the cycle? Understanding the causes and solutions for chronic urinary tract infections is the first step toward finding lasting relief. First, let's clarify what a UTI is. A urinary tract infection occurs when bacteria, most commonly Escherichia coli or E. coli, enter the urinary tract and begin to multiply. The urinary tract includes the kidneys, bladder, ureters, and urethra, and a UTI can affect any of these areas, though most infections occur in the lower urinary tract, the bladder and urethra. Symptoms can include a strong, persistent urge to urinate, a burning sensation when urinating, cloudy or strong-smelling urine, pelvic pain, and sometimes fever if the infection has spread. For most people, a UTI is an isolated incident, easily treated with a short course of antibiotics. But for others, UTIs become a chronic issue, occurring 2, 3, or even more times a year. This can be frustrating, embarrassing, and, in some cases, even dangerous if the infections start affecting the kidneys. So, why do UTIs keep coming back? There are several factors that can contribute to chronic or recurrent UTIs, and often, it's a combination of these factors that's to blame. One of the main reasons is the anatomy of the urinary tract, especially in women. The female urethra is much shorter than the male urethra, making it easier for bacteria to reach the bladder. Additionally, the proximity of the urethra to the anus means bacteria from the gut, particularly E. coli, have a relatively short journey to cause trouble. Another common factor is sexual activity. During intercourse, bacteria can be introduced into the urinary tract. Women who are sexually active tend to have more UTIs, especially if they use certain types of contraception, such as diaphragms or spermicidal agents, which can disrupt the natural balance of bacteria and make infections more likely. Hormonal changes also play a significant role. As women approach menopause, the decrease in estrogen causes changes in the urinary tract that can make infections more probable. The lining of the urethra becomes thinner, and the natural protective bacteria in the vagina decrease, both of which can contribute to more frequent infections. But anatomy and hormones aren't the only culprits. Some people have genetic factors that make them more susceptible to UTIs. These can include differences in the receptors on the lining of the urinary tract that make it easier for bacteria to stick and multiply, or immune system variations that make it harder for the body to clear infections. In other cases, underlying medical conditions can increase the risk of chronic UTIs. Diabetes, for example, can impair the immune system and increase sugar in the urine, providing an ideal environment for bacteria. Conditions that affect the flow of urine, such as kidney stones, enlarged prostate, or certain neurological disorders, can also make infections more likely by allowing bacteria to linger in the urinary tract. It's also possible that the infections are not fully eradicated by the initial treatment. Sometimes the bacteria hide in the bladder wall or form biofilms, a kind of protective shield that make them harder to kill with antibiotics. When conditions are right, they can re-emerge, causing another infection. Given all these potential causes, what can you do if you're struggling with chronic UTIs? The first step is to work with your healthcare provider to identify any underlying factors that might be contributing to the problem. This might include a thorough review of your medical history, lifestyle habits, and possibly some diagnostic tests to check for structural issues or other health conditions. There are several strategies that can help reduce the risk of recurrent infections. For some people, simple lifestyle changes make a significant difference. Drinking plenty of fluids, especially water, helps flush bacteria out of the urinary tract. Urinating frequently and not holding urine for long periods also helps prevent bacteria from multiplying. Good personal hygiene is important, but it's also important not to overdo it. Washing the genital area with mild soap and water is sufficient. Harsh soaps, douches, or feminine sprays can disrupt the natural balance of protective bacteria and actually increase the risk of infection. After using the bathroom, wiping from front to back helps prevent bacteria from the anus from traveling to the urethra. For women who experience UTIs after sexual activity, urinating shortly after intercourse can help flush out bacteria before they have a chance to cause an infection. Some healthcare providers may even recommend a single dose of antibiotics after intercourse for women with frequent postcoital UTIs. If hormonal changes are a factor, especially for women who are postmenopausal, vaginal estrogen therapy can help restore the protective bacteria and reduce the risk of infection. In some cases, a longer course of low-dose antibiotics may be prescribed to prevent recurrent infections. This approach is used with caution, however, because of concerns about antibiotic resistance and possible side effects. There are also non-antibiotic options being explored. Some research suggests that supplements such as cranberry extract, D-mannose, or probiotics may help prevent UTIs in some people, though the evidence is mixed, and these should be discussed with your healthcare provider before starting. Finally, it's important to recognize when chronic UTIs may be a sign of a more serious underlying issue. If your infections are not responding to standard treatments, if you have symptoms such as blood in your urine, high fever, or severe pain, or if you have risk factors such as a weakened immune system, it's important to seek medical attention promptly. Chronic UTIs can be a challenging and frustrating problem, but they are not something you just have to live with. By understanding the underlying causes, working with your healthcare provider, and adopting targeted prevention strategies, it is possible to break the cycle and reclaim your quality of life. Remember, every person is different, and what works for one may not work for another. With patience and persistence, most people can find a solution that works for them.